I'm Dr. Sumant, medical oncologist, currently practicing as consultant in medical oncology, Kaizen Oncology Network at care hospitals. Today, I want to discuss regarding the ways to prevent breast cancer. As we know that we are seeing an increase in instance of the breast cancer in recent years. Before going into the things that we need to do to prevent the breast cancer, I want to briefly tell you about what are the risk factors that are associated with breast cancer. Most common one is the increased age. As the people advances age has advanced age, the risk of having a breast cancer also increases. So this is one of the unmodified risk factor where we can't intervene. So the age itself puts the patient at high risk of breast cancer. So there are other few factors where we can modify the risk factors. So suppose women who have childbirth beyond 30 years of age are at increased risk of having breast cancer. So women who bear their child before 30 years of age has 2 times lesser incidence when compared to women who have their first children beyond 30 years of age. The other factor is having number of children. If the woman has more children, that means the risk of having a breast cancer decreases. Suppose a woman who has 2 children will have a lesser incidence or a lesser chance of having a breast cancer when compared to women who have only 1 child or who doesn't have children at all. So another one that decreases the incidence of breast cancer is breastfeeding. So it is always encouraged for the mothers to have to feed the baby with their own mother's milk. So all these factors point towards one common etiology, hyperestrogenic state. So women who have lesser number of children will be commonly exposed to high amount of estrogen. Who have a less number of children and who doesn't properly breastfeed. So all these women will have a high amount of estrogen in their body that itself puts the women at high risk of having breast cancer. Wherein women who have higher BMI along with obesity, they have higher estrogenic state. So there is a condition where their estrogen their hormonal levels are increased in obesity, so that the women will be put under high estrogenic state. So they have higher incidence of breast cancer. So they should always have a good exercise, proper balanced nutritional diet, so that their BMI doesn't reach their obesity levels. So apart from this modifiable risk factors, the one thing how we can detect early is by screening. All the women who reach their 45 years of age must undergo a mammographic screening. It will be done by every 2 years till 55 years of age. Later on, the frequency can be decreased to every yearly till around 65 years of age or more. So this puts in screening, women can be detected who can have their carcinoma breast. It can be detected early so that they can be diagnosed early, and at the same time they can be treated early, and so they have a higher chance of living for very long years. So it is recommended that all women who reach their 45 years of age must undergo mammographic screening to detect the breast cancer very early. So these are the few points I want to talk about regarding the prevention of breast cancer. Thank you.